Dear friends and viewers, there exist hidden corners in the inner world of men, where unspoken questions hold an invisible power to shape self-confidence, demeanor, and even the happiness of a couple. Penile length, a topic that seems sensitive and private, is, in fact, a silent concern for many men of all ages. Not everyone desires an extraordinary size, but almost every man has at some point questioned whether his member is sufficient to satisfy his partner, or whether he might be seen as inadequate. These doubts, though unvoiced, exert persistent pressure on the psyche, especially during life's transitional phases like middle age, when the body begins to show signs of aging, or after unsatisfactory experiences in one's intimate life. This anxiety should not be dismissed, but it also shouldn't be dramatized. The core issue is the need for a correct perspective. Penis size is not the sole determinant of sexual prowess or a man's dignity, but it can impact self-confidence, a crucial foundation in any relationship. And if there is a way to improve it safely and scientifically, why not? The goal is not to become someone else, but to feel more secure in oneself, to understand one's body, and to know how to care for it correctly. This is about self-respect, not inferiority. This issue deserves to be discussed openly, scientifically, and respectfully. Unfortunately, many men still turn to temporary, unverified solutions, simply due to apprehension. They hesitate to seek out qualified doctors to admit that they, too, have concerns that need expert answers. They fear judgment and ridicule, and it is this fear that pushes them toward risky choices. However, remember this: there is nothing shameful about a man caring for his own sexual health. On the contrary, it is a sign of maturity, daring to face a problem head-on and seeking solutions for self-improvement based on what medicine allows. We cannot choose our physical traits at birth, but we can absolutely choose to understand and improve them as adults. The difference lies in where you place your trust, in myths and rumors, or in a scientific basis. One path can lead to disappointment, even irreparable harm. The other, while the results may not always be miraculous, will at least offer you safety, accuracy, and, most importantly, the confidence that you are doing the right thing for your health. And now, let's explore 5 proven methods for increasing penis length. Method 1. Penis stretching exercises. Among the non-invasive methods for improving penis size, there is a technique that is basic, yet recognized by andrology experts for its effectiveness: manual stretching exercises. This is not a magic trick promising instant results in a few days. It is based on a clear scientific principle. The biological principle is a familiar one. Connective tissues, when subjected to a gentle and consistent pulling force over a sufficient period, tend to expand and restructure. These exercises typically involve simple movements, such as using the hand to gently pull the shaft of the penis in different directions: up, down, left, right, holding each position for 10 to 30 seconds and repeating multiple times in one session. It may sound monotonous, but when performed with persistence and correct technique, the penile tissue begins to adapt. The internal collagen fiber structures are gradually stretched, similar to how a rubber band that is repeatedly stretched will slowly lose its original elasticity. As a result, the length of the penis in its flaccid state, and sometimes even when erect, can be significantly improved. A study published in the European Urology Journal showed that men who performed stretching exercises regularly for 6 months, a minimum of 5 days a week, about 10 to 15 minutes per session, recorded an average length increase of 0.5 to 1.5 cm. While this number may seem modest, for many, it is enough to make a significant difference in perception, aesthetics, and psychology. More importantly, this method is completely natural, requires no medication, and has almost no side effects if performed correctly. However, a common mistake for beginners is pulling too hard, performing the exercises while the penis is erect, or using incorrect posture. These actions are not only counterproductive, but also carry the risk of injuring soft tissues, causing bruising, pain, or temporary erectile dysfunction. Therefore, consulting an expert or carefully studying the technique from reputable medical sources is essential. The success of this method depends on regularity, patience, and the ability to listen to your body. No complex equipment is needed. You can do it right at home, as long as you have a serious attitude and respect the process. An interesting aspect shared by many is that through the training process, they feel a deeper connection with their bodies. It's not just an exercise, it's a journey of self-care and understanding. In a way, stretching exercises are not just a physical technique, but also a way to cultivate persistence and discipline. Method 2. Penis extender devices. Building on the principle of tissue stretching from manual exercises, a technological solution has been developed to assist men more consistently and conveniently: the penis extender device. This is a compact medical instrument made of medical-grade plastic and lightweight metal, which works by creating a stable and continuous pulling force on the penis shaft while it is in a flaccid state. While it may sound unfamiliar to many, These devices have actually been used in medicine for years, and their effectiveness has been recognized through numerous reputable clinical studies. The device operates on a medical principle known as tissue traction. This pulling force is similar to orthopedic methods in plastic surgery or bone lengthening. When a body part is gently but continuously stretched, the tissue cells will self-divide to adapt, thereby creating real growth at a microscopic level. This process can help the penis shaft increase by 1 to 2 centimeters after about 3 to 6 months of regular use, according to results from many clinical trials. One of the outstanding advantages of this device is its consistent and measurable traction, which is difficult to achieve with manual exercises. Users can adjust the level of stretch at each stage and track their progress objectively. Furthermore, with its snug design, the device can be worn discreetly under clothing, allowing for use from 2 to 6 hours a day without significantly affecting normal activities. However, its use requires strict adherence to instructions. Some people may experience mild discomfort or pain initially. This is a sign that the traction may be too strong or the fit is incorrect. Reading the instructions carefully, consulting a doctor, and listening to your body's reactions are mandatory. A worrying issue is that the market is currently flooded with devices of unknown origin, which imitate reputable products with poor materials and flawed designs. Using these products not only fails to deliver results, but also poses a high risk of injury, bruising, or even nerve damage. Therefore, the sincere advice is to choose a product that has been scientifically proven and is recommended by experts. Using a penis extender is not just a mechanical act. It is a considered decision, a process of investing time and perseverance to improve oneself and take care of one's sexual health in a civilized and responsible manner. Method 3. Reducing excess abdominal and pubic fat. In the discussion about penis length, there is a factor that may seem unrelated but plays an extremely important role: the layer of excess fat in the abdominal area and especially in the pubic region, the base of the penis. Many men do not realize that a thick layer of fat in this area can bury a significant portion of the penis's actual length, making it appear shorter than it is. In other words, you might have a completely normal size but feel insecure simply because a part of its base is hidden by this fat pad. This not only affects aesthetics but also creates an unnecessary psychological burden. A study published in the International Journal of Impotence Research indicated that for every 5 kilograms of excess body fat accumulated, nearly 1 centimeter of the penis can be obscured. This means that if you are 15 to 20 kilograms overweight, you could be hiding 2 to 3 centimeters of your own length. This length can be fully reclaimed simply by losing weight. Reducing abdominal and pubic fat not only helps to reveal the true length of the penis, but also brings countless other health benefits: improved blood circulation to the genitals, enhanced sensitivity, and a boost in natural testosterone production. As the waistline shrinks, the penis will look longer and more prominent, leading to a noticeable increase in self-confidence. The most effective method for reducing fat in this area is a combination of a scientific workout regimen, calorie control in your diet, and maintaining a healthy lifestyle. Focus on full-body cardio exercises like running, cycling, and swimming, combined with strengthening exercises for the core and lower abdomen. It's important to remember that you can't spot reduce fat in one specific area, but as overall body fat decreases, the pubic area will be one of the places showing clear improvement. Regarding nutrition, prioritize foods rich in protein and fiber, limit sugar and refined carbohydrates, and ensure you drink enough water and get enough sleep. Many people have been surprised to find that after just 2 to 3 months of lifestyle changes, they not only see a clear improvement in their penis length, but also feel a renewed sense of vitality. In some cases where the pubic fat is excessively thick, especially in individuals with long-term obesity, medical liposuction may be considered. However, this should only be a last resort. Whichever path you choose, remember that losing fat is not just about seeing more, but also about living healthier, happier, and reclaiming your confidence from the inside out. Method 4. Hormone therapy. Only for those with testosterone deficiency. When discussing the improvement of physiological function, most people tend to focus on external measures. But there is an internal factor that silently governs a man's entire health: testosterone. This is the hormone that not only defines male virility, but also plays a key role in physical development, including the size of the penis during puberty. Few people know that a testosterone deficiency, even a mild one, can cause the penis to shrink over time, reducing its firmness, sensitivity, and even shortening its actual length. Testosterone is not just the fuel for sexual desire, it also plays a role in maintaining penile tissue structure, ensuring blood flow and muscle mass. When the level of this hormone declines, usually starting after the age of 30, men may experience symptoms such as fatigue, decreased libido, erectile dysfunction, abdominal fat accumulation, and particularly a feeling that the flaccid penis frequently retracts inward. Many mistake this as a sign of aging, But the root of the problem often lies in hormonal decline. Testosterone replacement therapy, TRT, is a modern medical method capable of restoring testosterone levels to an optimal range. When prescribed and closely monitored by a specialist physician, this therapy not only helps increase libido and improve erectile function, but can also help the penis regain its original fullness and size, especially in those who have experienced shrinkage due to prolonged hormone deficiency. However, it must be emphasized that TRT is not for everyone. It is not a miracle drug that can be purchased and used at will. Testosterone supplementation must be based on blood test results and a clear prescription from a doctor. Abuse or improper use can lead to dangerous side effects such as endocrine disorders, testicular atrophy, infertility, and an increased risk of cardiovascular disease. Therefore, if you notice symptoms like loss of libido, persistent fatigue, or an unusual sensation of penile retraction, see a doctor to have your hormone levels checked. Your body may very well need timely medical support. Correctly treating a hormonal issue is not just about size, it's about restoring the full vitality, life force, and confidence that a man deserves, regardless of age. Method 5. Penile lengthening surgery. When all non-invasive measures, from exercises and devices to lifestyle adjustments, still fail to deliver the expected results, some men may consider the final and most invasive option, penile lengthening surgery. This is a real medical procedure performed worldwide, but it is also the most controversial subject due to potential risks and sometimes unrealistic expectations. Essentially, this surgery involves cutting the suspensory ligament of the penis. This ligament functions to hold the base of the penis to the pubic bone. By cutting this ligament, the part of the penis shaft that is hidden inside the body is released and becomes more exposed, helping to increase the visible length by 1 to 3 centimeters. It is crucial to understand that this procedure does not create new tissue or increase the actual total length, it simply reveals the part that was already there. In addition, a surgeon may perform supportive techniques such as autologous fat grafting to increase girth. These are all complex interventions that require a surgeon with deep expertise in genital reconstructive surgery and must be performed under strictly sterile conditions. Potential risks include infection, bad scarring, loss of sensation, changes in erection angle, or even penile retraction if postoperative care is not followed. One of the biggest challenges of this surgery lies not in the technique, but in the patient's psychology. Many people approach doctors with unrealistic expectations, such as hoping for a 5 to 6 centimeters increase. In reality, the improvement is usually in the range of 1 to 2 centimeters and requires the patient to persistently combine it with postoperative stretching exercises for many months to maintain the result. Therefore, surgery should only be considered in truly necessary cases, such as when the penis length is so short it causes difficulty in intercourse, a condition known as micropenis, or due to congenital defects or trauma. Those with an average size who suffer from psychological obsession are often recommended psychological therapy or sexual counseling instead of opting for surgery. Surgery can change a number, but it cannot change how you feel about yourself if you do not change your mindset. Strengthen your self-confidence and self-worth from within before deciding on an external intervention. Dear friends and viewers, we have walked through 5 methods for increasing penis length, approaching the issue from a scientific and practical perspective. There are simple ways that require investment, and even more invasive interventions. But in the end, what you are truly seeking is perhaps not just a few centimeters, but confidence, peace of mind, and a sense of mastery over your own body. If you are feeling insecure, don't be too hard on yourself. That feeling is real, but it does not define who you are. What defines your worth is how you act. By seeking knowledge and choosing scientific and responsible solutions. Length can change, but a man's value lies in how he respects himself and loves his partner. Thank you for watching. If you found this content helpful, please share it and subscribe to the channel so you don't miss out on scientific, practical, and humane knowledge about sexual health. We are here to accompany you on the journey to understanding and mastering your own health.